to welcome everyone again to the How to Identify Multi-Sector Partners. Again, my name is Gina Rodriguez, and I am the project manager for the Community Health Training Institute, which is hosting this webinar today. We are able to provide this webinar for free. Thank you to the Department of Public Health. And our webinar this morning is going to be led by the Director of Training and Capacity Building here at Health Resources in Action, and her name is Lori Jo Wallace. And as we get started, I am going to tell you a little bit about how this webinar is going to work today. Let me see if I can get it to play. Oh, there we go. Sorry. So how this webinar works is that if you have any questions, you have a question box to the right of your screen. So if anything comes up, if you're having audio issues, if you have questions about the content, please feel free to plug it into your question box so that we can see it. And we will save most of the content questions for the end, but if you are having, again, technical difficulties, please feel free to plug it into the question box. Immediately at the end of the webinar, a survey will pop up for you to answer some questions about how you thought we did today, so we'd love to hear your feedback. And then a few days after this webinar, you will receive the resources, all the slides that our presenter is going to be sharing with you today in email form. So you'll definitely get all of that information. And we also encourage you to use our hashtag MACoalitions to tweet us questions or comments at our handle, which is @HRIA Institute during the webinar. Again, this is what your question box will look like. You will be muted, so again, if you have any questions, please feel free to use the question box. And we're excited to present you with this webinar today, so I'm going to hand it over to Ms. Lori Jo Wallace.
Hello, everyone. Happy to be here with you today. As Gina introduced me, I'm the Managing Director of Training and Capacity Building here at Health Resources in Action. And I've been here a long time, many years in the field, and I'm really excited to talk with you today about partners and identifying partners because it's such a key piece to all of our work in public health, but specifically to, I think, to coalition work. It's very important. I come from years, as I said, of working in the field. I have a big expertise in engaging young people as partners, but also have worked with many coalitions around engaging partners, around thinking about how to move the coalition work and sustainability in the Boston area, in Massachusetts, and even in some other places around the country. So I'm looking forward to presenting this information for you, and we tried to make it somewhat interactive with some questions at the beginning and the end, and then some polls. So please jump on in with us, and I hope you learn a lot today, or I hope you affirm what you already know. So the learning objectives for today are it's really about identifying. That's the focus of today. Part of identifying is really engagement, but we're really starting out with who really needs to be at the table, and if this is something that you have done a lot already and you just want some rethinking about it or some new ideas, hopefully that can happen today. If it's something that you maybe are starting your work with your coalition, it's a great place to start in thinking about this. And then we also are looking at some of the tools to really help you think about who are your stakeholders and who you want to be at the table and how you're going to need to reach out to them. And thirdly, really identifying specific strategies to reach out to these potential partners. Part of identifying partners is engaging partners. And so we will talk about some of what happens when you actually really engage them, because just identifying and even recruiting people isn't really enough. But that also leads to longer-term work that will happen. There's some other trainings happening in the Community Health Training Institute that will support that as well. So we wanted to start off right away with a question for you. So please, as Gina said, type in the question box because we really just want to address what is your biggest challenge you have in identifying multi-sector partners. And if you want to start typing in some of your challenges, we'll see if we can address some of this today. Can't promise we can address every challenge, but hopefully we can at least look at some of them. So I'm going to give a minute or two for people to type in what is the biggest challenge you have in identifying partners. You can also think about recruiting them as well as identifying them. Not seeing anyone typing in yet, so I'm hoping that folks will be able to. And if it's not something that you want to do, we'll move on in the presentation. But it'd be great to hear from you. So you can just type right in that question box. What is your biggest challenge? And I'm sure people are thinking too, so that's good. All right, we're getting some in, so you cannot all see them, so I'm going to read them to you. And I'm not going to talk about each one of them, but we're going to take notes and make sure that we try to address a few of these as we go along. So starting out with from Pat Donovan, finding the right person to speak with. So who is that person to find, and who do we really want to get onto our coalition? So we'll definitely talk about that today. Hard to know what all the organizations can actually bring to the table. From Beverly. Lizzie, establishing actionable criteria for collaboration or discrete division of responsibilities. So really, what kind of things do we really think people are going to be able to do and when they're a part of our table, and what not only can they bring, but what actually are they going to be able to produce or help with in terms of the work. So those are three good ones. We feel free to keep typing in for a minute more before we move on. I do want to say that in terms of our work, we are definitely going to be looking at thinking about the right person, which is a really key piece. In my experience, when you go in a lot of community meetings, coalition meetings, it tends to be all the same people going to the same tables. So how do we really think about that collective impact? How do we really think about not us all doing the same things at different places, but coming together? And maybe we don't all have to be at every meeting. Maybe we can really think about where do we bring the biggest bang for our buck, which I think is about the actionable criteria as well. So I think we'll go ahead and move on. If you want to add questions some more at the end about questions or anything more about your challenges, we can certainly do that as we move on. And you three folks that did write up there, we'll try to keep talking about these three issues as we move along in our presentation. So we wanted to start out with some definitions, and I do have to say that a lot of this information has been gathered over the years from our organization and from many other organizations. We access a lot of resources in the community, and we put them together in terms of our experience in the community. And by our experience, I mean Health Resources in Action, where I work. So this information isn't only our information. We didn't create it all, but we've taken it all and tried to adapt it to make it very practical for people. But there's a lot of resources around coalition work, and we do use them as we do our work. But we did want to start out with some definitions. So when we talk about community, what are we really talking about? Community is a broad term that's used in a lot of different ways. So I like this definition. It exists when people who are interdependent struggle with the traditions that bind them and the interests that separate them so that they can realize a future that is an improvement on the present. So I think that's very applicable to our time right now as well, but really thinking about the way things have always been, and my own personal interest, again, back to that collective impact. The community is really coming together, and community coalition work, I think, is really coming together to look at how do we make a better place for all of us. Engagements. We talk a lot about engaging stakeholders, recruiting, identifying, recruiting, and engaging. So engagement, what is that? The process of working collaboratively with and through groups of people affiliated by geographic proximity, special interest, or similar situations to address issues affecting the well-being of those people. So as we know, community can be a geographic, but it also can be a group of people that share interest or share personal personal characteristics. There can be a lot of different ways that community is defined, and so engagement of those people, we need to take that into consideration. So engagement of the people that live in Dorchester, or even a neighborhood, a block of Dorchester, might be different than the engagement of the LGBT youth community in Boston. We need to really know those communities to think about how we're going to engage them. And obviously we can't know everything, but that's the whole idea of the multi-sector partners, to really think about how we can build those relationships with the different folks from different communities by working with people who are from those communities. And again, it's about addressing the well-being. And finally, partnership. There's actually, I've done other presentations on partnerships. There's actually a lot of levels of partnership, all the way up from just networking to real collaboration or collective impact. So there are levels, and I think what we're talking about is really can be a collaboration, but as we get into the webinar today, we're going to talk about actually levels of partnership and how every person that you recruit to your coalition may not be on the same level of partnership, and people may come in and out, and I think that's a very important thing to remember. So a partnership is a type of organization which two or more individuals pool money, skills, and other resources and share profit and loss in accordance with the terms of the partnership agreement. A really important piece there, sharing that profit and loss. If you don't really have something in the game, if you don't have any skin in the game, as they say, or if you really don't have it a part of your own interest in the game, it's much harder to care as much about the partnership. And I think that's one of the big challenges that comes up, and we're going to talk about challenges later, is that it is hard sometimes when you're trying to engage folks to really get them engaged at levels if they don't feel like they're going to lose anything, if whatever the activity or program or project you're working doesn't work out. And there are groups that come together where money might not be involved, but I think we really are talking about sharing resources and funding as well as skills in terms of partnership. So I just want to start out with those definitions. I think sometimes we jump into this work not thinking about what we mean by partnership, what we mean by engagement, and what we mean by community. Again, I think partnerships can be at different levels, but we're talking about trying to build partnerships where people really do have some shared profit and loss in the work. So we're going to move on into really looking a little bit at, so what are we talking about with the vision of a healthy community? What do we mean by a healthy community? These next few slides are really sort of the theoretical background and theoretical approach to why we should do multi-sector partnership engagement. Why is it important? And so I think it is important and valuable to take a little bit of time to think about that, to think about why it actually works to do multi-sector partnership engagement. And I think sometimes we have to do it because of grants, or we're told to do it, but if we can really believe that it's going to make our work better, that makes a big difference. I know in doing a lot of youth engagement work that sometimes people say, oh yeah, we want to engage young people, but if you really believe that by engaging those young people, your work is going to be better and effectively impact more young people and in different ways and more creative outside the box ways, it's going to be much easier, and you're going to be much more open to really making that happen. So it's really why do we value this partnership? This is what this next part is going to be about. So this is the vision of healthy communities that really was created. It's a national movement, Healthy Communities. You can find a lot of information about it. I think Massachusetts has done a wonderful job with our partnership, Health Resources in Action, the organization we work for, but also many folks in Massachusetts have worked very hard to develop this vision of healthy communities for all. So we wanted to spend a moment in we talked about what community is, this group of people working together to make a better place for everyone in the community. But here's more information about what a real healthy community might have in place. So a broad definition of health and community. I think we have moved this scale a little bit, but for a long time when people said health, and I still think probably a lot of people, when they do say health, they mean your individual physical health. Don't necessarily mean how it impacts all of us. It really is talking about, oh, okay, I got to go take care of myself, or maybe myself and my family, and go to the doctor. But we're really talking about health, obviously, in its broad implications. How does the health of having transportation, public transportation available to all impact that community. Housing comes up all the time now in every community conversation that arises, because it's in cities like Boston, it's a huge issue. And I think not only Boston. I recently did some work on Nantucket, the island of Nantucket, and obviously that housing is a big issue there because there's so many very wealthy places to live, but not really a lot of easy places to find year-round living for maybe more than middle class or working class communities. So health in its broad context, a shared vision based on community values. Again, that's a broad concept. So what are our community values? I think, what does that mean? And is it clear to whatever group you're working with what those values are? I think that is a place to start. I think a lot of folks are discussing health equity in recent times and looking at health equity. Yesterday, the Mass Public Health Association had its annual meeting, and the focus was health equity and racial equity. And I think we need to really be clear about what are our values in creating our healthy community, and get a chance for people to weigh in on them. And even if they don't buy into each value 100%, at least be able to agree that that's what we're moving towards. Which leads right into the next one, diverse community participation and ownership. That is directly what we're talking about today. That if it is a coalition of one or two people that are trying to create change in the community, it's probably not going to happen, or at least not to the level that it could happen. I have to say we're really proud of this next one because we made sure that got inserted in Massachusetts, but investing in youth leadership and development, that young people are a lot of what public health is targeted for and around, and so we really do need to make sure that they are not only a part of the picture and a part of giving feedback, but we are supporting the development of public health leaders to move into the work that all of us are doing now. Systems change. The next few slides we're going to really talk about that more, that we really need to focus not on only the activities, get in the activity trap of one activity after another, but how are those activities really moving towards a system? And I don't think any of this is easy work. I think it's working with but I think multi-sector partners are really the goal of moving to systems change. Capacity, using local assets and resources. So wherever your community is, you need to look at those assets. That it's really important to be sure that we're not going into a community thinking that any community, no matter how struggling or challenged or poor the community is, that there aren't assets. That there are assets and resources in every community and every group of people, and we have to be very clear. Just in the same way, we have to really value diverse engagement. We have to really believe that each community has its assets and its resources to contribute. And finally, we gotta benchmark it and measure it, and that's a really important piece of this work, that we need to make sure that we start out at the beginning saying what's in place and how are we going to measure this progress. And it doesn't all have to be on. It doesn't all have to be about data, certain changing data around smoking rates or alcohol use rates or whatever the focus topic of your coalition might be. It really can be around qualitative progress and how comfortable do people feel in hanging out in the community. I was recently in Lowell, Massachusetts for a training, and before the training it was around 2 o'clock or after school. I went to the Dunkin' Donuts to get the local Dunkin' Donuts to get a cup of coffee, and I was so pleased that there was all these young people, high school age young people, sort of just hanging out there and having coffee. I don't know if they're drinking coffee, maybe hot chocolate or whatever, but they were doing their homework and chatting and hanging out. And there was the man behind the counter. It was the most warmest, nicest guy, and he was just friendly to everyone. And they really felt like it was their place to hang out, which is something that young people and all of us really need to feel. And to me, that would be a benchmark of a healthy community, not just places for young people, but for elders, for all folks to be able to hang out and feel comfortable. So those are some of the values of the healthy community vision and values. And just a little more theoretical background before we get into the nuts and bolts of identifying partners, which I know people want. But again, I think it is important to to focus a little bit on the theoretical background and why we're doing this multi-sector work. And some of this might not be new to you, but it's always interesting to gather new data, or if you haven't seen this particular graph or chart or data before. And these three next slides are all sort of different aspects of the same view, or sides of the same coin, so to speak. So this is really looking at what are factors that actually influence health status. I already talked about the health of the broad community. So quality of care is actually one of the things that in access to care, we talk a lot about. It gets a lot of focus in our work. It seems like healthcare is such a huge issue, and typically we're talking about individual healthcare, doctors, nurses, hospitals, that kind of thing. And yet, what influences status is only 20%. 10% actually are physical environment, and then 30% are behaviors. Again, a big focus traditionally in prevention, and sometimes I think we do get caught again in that trap of activities to get people to change their healthy behaviors. But if 40%, which is almost the majority over all those other factors, is really the social and economic factors. Education, employment, income, social support, family support, community safety. That's really what identifies the health of a community in terms of this particular chart. I'm going to go on and look at the next one, which is the socio-ecological perspective. Again, talking about working that all of this needs to be in place. I remember when we really moved some years ago in prevention, a long time ago now, from really looking at the individual education and moving to the environmental, the shift to, in all of prevention, to really trying to look at the environmental strategies in prevention. So the idea that, we just heard this analogy yesterday of a goldfish at the Mass Public Health Association meeting, a goldfish swimming around. We can give them food, we can give them we can ask them to do exercise in their little bowl swimming around, and we can do as much as we can to encourage healthy behavior. But if their water is dirty, and this really actually goes back to this slide, if their water is dirty, then it's going to be really hard for them to be healthy. We need to change that, and we need to really look at how we identify it. And that's what I think is so important about coalition work, is you are really working in the community. You are really broader and often looking at policy and organizational change as well as the interpersonal and individual. What I think is interesting about the socio-ecological perspective is that it's all of those levels. It's the individual knowledge, attitude, and skills that is important. We can't forget about that. If we don't keep changing the norm or working to change cultural norms, working for education, working to engage people, we aren't going to change other things. That is a part of it, as well as the connection to families and friends and peers. Looking at our institutions, which really hold so much power and weight, schools, churches, other religious institutions, government bodies, and how much power they have, and then communities, which are, so again, another piece of the theoretical background to this work. And finally, I'm sure many of you may have seen the Frieden Pyramid before, that came out of the CDC, the Center for Disease Control. But again, it's just emphasizing the same idea that we spend a lot of time looking at counseling and individual education, and I think when there's crisis, that is what happens. We focus a lot because crisis always, it's hard to leave that person on the street that's really in need. We need to address those people at most need who need the resources. So the crisis, the clinical intervention. But I really believe the coalition work is looking at these last three levels, which in the Frieden Pyramid is about what is saying is creating the most lasting impact, which is in relation to those two slides before, the long-lasting protective interventions, changing the context to make individuals default to decisions healthy decisions. So I think really looking at what lasts for a long time on the interpersonal level, but in the community, what is making it easy for communities to make that, for people in those communities to make those healthy choices, making it easy and accessible and fun, and not the, I remember seeing an example one time a long time ago of what getting people to take the stairs instead of the escalators. It's really amazing if you ever observe how much, even in a one, and you know, if you're lugging something, I get it, or if you need to take an escalator because of physical reasons, but people, there'll be a huge stairway and everyone takes the little skinny escalator on either side. And I saw a presentation one time about trying to get folks to take the stairs, and the stairs, when you went on them, they lit up and made musical noises, so you could make a song going up and down the stairs, and they lit up in colors as a way of making it really the easy kind of fun choice. So again, maybe that's something we need to think about in our coalition work. How do we really make our communities places where people want to be and make the choice to healthy decisions, the easy choice, the fun choice, the choice where it's really important, becomes important to people. But the big place on the bottom that really creates the most change, of course, is the socioeconomic factors, which reflects what we saw in the slide before, the first slide about from Healthy Wisconsin. So how do we really get to those factors? I think it is challenging, and I think a lot of the work that sometimes we feel about, you know, maybe we feel we're not doing such key work in our communities in terms of really impacting some of the core things of racism and hate crimes and things that are really hurtful to, when we hear about, are hurtful to us. Maybe making, you know, bike paths doesn't feel like that, or making that an important place in a community. But all of that impacts the socioeconomic factors. Really getting people's communities to have healthy food and bike paths does connect to other kinds of actions that make a community a healthier place. So really, just again, that's really the theoretical background. That's why we really want to have these multi-sector partners, because until we have people representing all of our communities, we're not going to be able to make so much inroads in some of those lower levels. We're not going to be, we really need to have, going back to this slide, all of the folks in the community to impact those kind of change. And we can't do it alone, and we need to really reach out and who represents our community, and really look at pulling them together. So I'm going to move on to specifically focusing on multi-sector partnerships. So we're going to move into doing a poll to have you vote. So here's the time to be interactive. So I hope everyone can jump in here. Here are some of the real reasons we value multi-sector partners in terms of the research, in terms of listening to communities. They help us address new and broader issues. They help us develop wide support for issues. So sort of that community norm change that we talked about before, really reaching a broader community, changing norms. Encourage collaborative problem solving. And I always think about this when I think about hiring somebody who might be a little different for me to work with us, or engaging someone who has a completely different experience, that they are bringing that experience to the table, and they are really going to maybe change it in a completely different direction, but it could be such an exciting direction, a different direction. Culturally relevant solutions. So again, a community that might really be look one way at one time, maybe we're not really clear about all the different cultural groups that are in that community, and that some of the solutions we might come up with might not be a great one to impact that for impacting that community. Coordinated approaches. And again, we're not going off in a lot of different directions, but we're picking a few directions maybe, to working together on them, minimizing duplication of efforts. And then these last, we're going to actually have you poll on the top 6, and then just wanted to add in increasing communication is also important, and the leveraging resources. So this is the time for you to do the poll, and so we want you to, you can select all the ones that apply, those 6, and here, see what you come up with. We'll just give you a minute to do that. Okay. I will give it one more minute. I think it looks like a lot of people have voted so far. If you want to vote, give you a minute more. And then I'll read you this, what happened. It's changed a little bit. Okay. So as you can see, here's our results. It's pretty interesting. So addressing issues and developing support for issues. Move right up with collaborative problem solving is the highest. That's really interesting. And culturally relevant solutions and additional resources. So that's very interesting. I salute you because I think really being open to collaborative problem solving, it's not easy, especially if we've been doing the work a long time or we feel like we really have a good knowledge about it, to really be open to someone bringing up something different, having some different ideas. That can be a real challenge for a lot of people, and I think that the fact that you all believe that and want to and really value that is very heartening. I think that's great. I want to say something about the culturally relevant solutions that just struck me is that it's very interesting to me because I live in a community of Boston called Roslindale, and if you came there in the evening, you would think, because there's actually, I don't know if people are familiar with it, but there's actually been developed a lot in the last, I don't know, 10 years at the most. A lot of restaurants have come into the area that weren't there before. And so there's quite a few nice restaurants and fun restaurants and bars and things where people go at night. And if you went there in the evening, you would think that the community was, I don't know, 90% white folks, because that's who's out, that's who's in these restaurants. Because a lot of people come from other places. If you went there in the day, you would see that our community is very ethnically diverse, and it actually is. I think Roslindale and Hyde Park and that area of Boston tends to be some of the most ethnically diverse areas, with folks from a lot of different ethnic groups, Asian, Latino, African American, coming together and living there. And so it's really interesting, even when you view a community, how you assess it. And so I think really trying to reach out, figure out what is interesting to different people, what's going to really engage them, how are we going to really make that happen in terms of really thinking of not just solutions but strategies and things to create. I mean, I think most people want a healthy community, so how do we really engage people from different places? And I think even the time of day that you have meetings or view communities can be very different. So thank you for that. That's interesting, and we'll continue to think about that as we talk about multi-sector partners. And we will move on to something that's pretty well known, maybe well known to people, but it's very interesting because as I was talking about this webinar with one of our real experts in the field, who is now the president of Health Resources in Action, named Steve Radini, I actually talked to him about this. Next slide. Which is the famous stakeholder wheel. So you may have seen this before, but I was told by Steve that he really came across it the first time, and years ago when he was doing substance abuse work or substance use disorder work in the community, and this was in the Midwest, and it was really a parent group who wanted to engage more folks in their school that he first saw came up with this idea of the stakeholder wheel. So it's very interesting to think about that and to think about who, if you were creating your partners, who you might put in this wheel and all the different folks. Now sometimes it's dictated to us by the grants, like as many of you know, the drug-free community grants, the federal grants, have 12 specific stakeholder groups that need to be represented. However, I mean, again, hopefully valuing those cultural solutions and in valuing the collaborative problem solvers, hopefully we can not only think about what a grant asked us to do, but also who is in our community that we really might want to represent. So you can obviously take this and fill it out with who you want, but through our work in the community, we've actually developed one that has a bunch of different groups on there. And again, I'm pretty sure that all the 12 from the Drug-Free Communities grants are in this stakeholder multi-sector partnership wheel. And as you look around it, you can see that it really is helpful sometimes to have a starting place. There's a lot of blanks over there on the lower left-hand corner for you to add things to. But we did try to include many of them. Transportation, starting at the bottom and going up. I'm not going to read out loud them all because I think you can read them, but we really tried to include almost every group that we could think of when we filled in the wheel. So I think the key of this multi-sector partnership wheel is that, one, that there is some groups across every community that we probably want to engage, but there are obviously maybe groups that are specific to your community, so it's very easy to customize. So I wanted to ask you to take a moment and we're not going to give you too long here because in a webinar it's a little more challenging to do this than in an in-person training, but to think about who is in your coalition now and to really put in what I ask people to do, and maybe you'll do this after the webinar as well, put in one color who you have represented, and actually the names of the people and the organizations. Because I think for me, one of the key things I found in doing this work is it's not just the organization, it's really the person at the organization, and that's what makes it challenging, because when people move on, you've developed this relationship, you have this great person, and they move on to another organization, or they move away, or they're doing something different, and you have to find a new person. So what we ask people to do, and you can be doing this right now just as I'm talking, but to fill in who you have in existence and the actual name of the person and the organization. You can put it right on the outside of the circle. You can add in some different ones if you have ones you want to fill in. And then in a different color or in another way, really highlight who you might want to target. Where do you and why do you want to target them? What's the reason that, and this is a great conversation or activity to do with the active members of your coalition, what is the real reason that you want to have that group in there? How will they help you move toward your collaborative problem solving, to you making your community a better place, to you focusing on the issue that you're focusing on? And again, if you know the name of a person, that's really important. And we're going to be talking about, so really identifying how do you actually find the right person, which someone brought up at the beginning, which isn't, I don't think there's a one easy answer, but I do think it's worth strategizing around. So if you want to take a minute to think, even just to think about that, who do you have now and who might you want to have? That's really what we want to think about in this multi-sector partnership. Again, I just want to talk about the importance of customizing it to really make it suit, one, what is your coalition trying to do? You know, I think there is some coalition work that we're trying to do a lot of different focuses or topic areas, but usually coalitions have a focus or a topic area. A lot of our strategies, hopefully, that our coalitions are working on, hopefully address some of those broader issues on the bottom of the freedom pyramid, the socioeconomic issues. So maybe they're not only focusing on a substance use issue, if that is the topic of your coalition. Maybe they're focusing on strategies to make for places for young people to hang out, which could meet many topic areas, or strategies for elders to get their needs met or have social life, which also could meet many issues, topic-related issues in terms of prevention, substance use, physical health, nutrition, a lot of them. So as I'm talking here, I'm hoping you're really thinking about who you have now and who you might want to identify in different colors, and then why. And again, this could be an activity for your coalition, for your leadership team, for your steering group, for you to do in the future. So this is one of the tools we're offering you. Another tool that we have found very valuable is this tool, and a lot of folks have been interested in this tool. So this is really just taking the wheel and adding another step to it, and making it a little more detailed. And I think this gets a little bit to the why, but really the kind of engagement that you want from them. And I think someone asked in the challenge in the very beginning of identifying people is sort of what actionable things that you want people to do. So this I believe speaks to that. What are they bringing with them, and what can they actually do as a part of your coalition? And also I just wanted to point out at the top, the recruitment, identifying recruitment plus engagement equals retention. So it's really hard to talk about just recruitment without talking about actually engaging people. There's I heard a while ago, there's a high percentage of differential in when you finally get someone to come to a meeting and they come once, and then there's this big percentage of people that never come back again to a meeting or a group. And so it was interesting to think about why that happens. And I think there was actually a study, I read it was an article and I read it, and there was a study asking people why they never came back, following up with them. And a lot of times they feel like they're not a part of it. They feel left out. It's that whole old feeling of being back in school when you're on the outside of the in-group and everyone knows each other, everyone's using language and acronyms that other people understand. They're having a good time, or they're very vested, and the new people don't feel a part of it. So having an engagement strategy from the get-go, and who's really religious institutions are often very good at that. They have that sign-in book. They set up you with a buddy. I remember I was thinking about going back to a religious institution some years ago. It hadn't been in a while, and I was kind of exploring a little bit in my community. And I went to this one beautiful little place, and as soon as the service was over and I walked out the door, 3 or 4 people came up to me and welcomed me and said, I hope you can stay for the coffee afterwards, and we hope to see you again. I had rarely been to any event where I felt so welcomed. So anyway, I think really that, you don't want to overdo it and scare people, but I think that that's a really important thing. Right from the get-go, once you've identified your people and recruited them, and you've got them to come to some event or some connection or even a coffee or a meeting with you, you want to be sure you have an engagement strategy in place to make your retention. But anyway, back to this tool, I think people have found it very helpful because it actually talks about the organization and the individual, who is the key contact, and what is their role. So you may have an organization, and obviously if it's an individual, they are the key contact and who they are. And then what are you really hoping that they will do? So not just what sector do they represent, but what will they really do on your coalition? Are you interested in helping them with leadership and facilitating, or do they have a communications expertise? A lot of you talked about access to resources. Do they have some resource? And not just funding, but other kinds of resource. Connection to volunteers, finance, or expertise in evaluation. I know one coalition that I work with at Ashland, the leaders of the coalition are both scientists, and they both are, and the coalition is about substance use prevention. They've been going for a while. They have a federal drug-free communities grant. But it's very interesting to me, they've never hired outside evaluators because the 2 volunteer leaders, I think the chairperson and the lead staff person, but she's only a team because she has a full-time other job, are both very versed in evaluation. They're both scientists. So they do their own evaluation, so that's obviously a great thing for that coalition because they don't have to think about hiring out for something in terms of their drug-free communities grant. And then how much are you hoping they're engaged? And this is going to relate to our next, into a slide coming up about engagement. So when you think about this engagement frequency, we have different levels of engagement in a slide coming up that you could put in this column, or you could just say, we want them to come every meeting, we want them to be on leadership, the steering committee, however you want them to be engaged. So this is really a chart folks have used and refers back to the wheel. So you want to be sure that you're connecting back to the wheel who you want engaged as well as what you want them to do. So in moving on, we do have a little bit of a case study for you. So here's our wheel, and we wanted to talk about the 84, which is a program that Health Resources in Action runs with the Department of Public Health. And as you say, as I'm adding here, these are some of the partners that we, through the 84, have worked with to really become successful. And as soon as I finish adding them all in, I'm going to talk a little bit more about it. So some of you may be very familiar with this, so I won't go too much in depth about what the 84 is. There's a website you can look at if you're interested. But it was started about 10 years ago. I mean, we've done, in our agency, we've done tobacco prevention through the with the Department of Public Health in Massachusetts for many years. But this particular version of it was youth tobacco prevention and health promotion was started about 10 years ago. And it was called the 84 because it stood for 84% of young people who don't smoke cigarettes. And it was really a social norming campaign. And the real grand success of the 84 around cigarette smoking is it's now 90. So at some point we're going to have to figure out how to change it or do something different. But 90% of young people, so it could be the 90 who do not smoke cigarettes. Now that doesn't mean there aren't other issues around tobacco prevention, and then we could talk more about that around other tobacco products and vaping and e-cigarettes. But I think the big success of not tobacco is it's a huge success, and it's a huge public health success that I think we need to really think about and look at and be proud of, because many of us worked, and many of you may have worked very hard on it. But in terms of multi-sector partners, I think we really wanted to look here at how is this, and this is a big statewide movement. It's a lot of people and energy have made the success of tobacco prevention in Massachusetts and have worked very hard on it for many years. The 84 is just one element of it, but sorry, but these, so around there, I want to talk about, and we really do this in partnership with the Department of Public Health, the Mass Tobacco Control and Prevention Program, because they really are the biggest partner in it. And so we really should be, we're really the coordinators of it. But some of all of these groups all around there on the wheel are organizations that have chapters. So it's really a chapter-based organization, and anyone can become a chapter if they have 5 young people and 1 adult, and they get support and resources, again, through the Mass Department of Public Health and through our work and training. And then we do a big event, a couple big events a year, but the big one is Kick Butts Day, where all these young people come to the State House, and it's really quite an exciting time. And they get, I mean, what was wonderful about it, it's not only, I think, really pushed the tobacco cause and kept funding in tobacco, but it also has really, it's a great youth development movement. All these young people getting to learn how to speak to legislators, meet their legislators, so it's quite a successful event. Couldn't be done without all these chapters. But I want to really point out the Mass Municipal Association, the Campaign for Tobacco-Free Kids, Tobacco-Free Mass, which actually isn't up there but could be. And we actually have funding now from CVS Health Foundation, that all of these partners that are more adult-focused partners really are not youth programs, as many of these are the youth programs and the youth chapters, but they have worked in hand, and I don't think the change would have happened without all of the partners. Not the youth have done a tremendous job in the youth chapters, but the adult chapters, the Mass Municipal Association, the Campaign for Tobacco-Free Kids, which is an adult-run organization, Tobacco-Free Mass, they've really made this happen in collaboration with the Department of Public Health. So that's just an example of it was structured from the beginning to have a variety of partners. And we really do try to look at different kinds of youth programs. Some are school, like many SAD, you'll see SAD down there. Many SAD chapters are in schools, but they're also also many organizations, because when we get an organization involved, we not only get their youth group, but we get other things like Tobacco-Free Africa. We have connections to a whole other community. The Cambridge Health Alliance, we have connections to the health and health access, as well as to the youth program. So that's just another example of really a multi-sector partnership that's been very successful. Another thing we just wanted to comment on, and I brought this up a little bit earlier, but one of the big challenges I think in coalition work is how a lot of folks want to go in different ways, do different efforts, and the whole goal of multi-sector partners is that we really try to come to collective impact. So I think multi-sector partnership engagement and retention, as well as even identifying, is really supported by a well-run coalition, a coalition that can really have uniform goals and measures, have different approaches, but they change, has coordinated action, common purpose, started in the middle there, but up to the top, common purpose and vision, and what we're talking about is cross-sector alignment. That, I think, is really another important piece, that coalitions are meant to be a place where different sectors come together. That's really sort of their goal. And if we don't think about who's coming in, that we are really working for this common purpose and vision, then it can be very challenging. And people can go off in their own ways, and you can get very stuck. Or the staff of the coalition is just really killing themselves trying to support a zillion different efforts. And how can that I've seen that happen a number of times in our coaching and our work with coalitions. We do some coaching with Rhode Island, which has a really interesting model. They're called the HEZs, which is the Health Equity Zones. And instead of funding different coalitions around different topic areas, they've really tried to bring them together. So it's interesting to bring them together with their physical health and nutrition work, as well as their substance abuse work and other kinds of work in one zone. But what happens is, I think many of the coalition leaders staff are trying to bring all these separate efforts together. So I think it does take some time, which involves planning. It involves coming together and really realizing that you might not be able to do everything your organization wants to do, but in the context of this project or this work, we really want to move in one direction. So, and I think that also how the staff, in trying to bring different separate efforts together in a coordinated vision, really be able to try to delegate and create leadership among the community, so that other folks than themselves can be doing this work. So that's really two things there. One, coming together, really getting people to be on the same page, planning. And I think it takes time, planning, and patience. It's not going to happen right away. As well as what you're doing, having folks at least come together with some common purpose and goals and measures, that then you really think about how can you build leadership so you're not as a staff running everything and doing all the work. It takes time and is some complex, but having a multi-sector partners, having a lot of partners really helps promote that collective impact. So we're coming to an important piece, which goes back to that levels of engagement, and I think this has been really helpful to people, this particular tool. So again, recruitment plus engagement equals retention. But when we're identifying partners, when we're really looking at who we want to be in our who we need to be, who we want to be, what we think will really move us in a collective impact way, this has been helpful for people to think about. I think one of the big challenges is that often we feel, as people that manage coalitions or run coalitions or staff coalitions, that everyone needs to be in that core circle all the time, that everyone needs to come to everyone we want of that big multi-sector wheel should come to our meetings and really be a part of moving the agenda. And I don't think that's really really what you do want. And I think that you are going to have those core circle people, your leadership, your steering committee, your people that are just there every meeting. But there are different levels. And then the circle of engagement, so folks that you engage but maybe come to one meeting or really help with one event, and then they move out. Your circle of champions, so those people are the people who can bring you resources. And I'm going to talk a little more about that later. And then your other levels, your circle of information and awareness, people that may know about you, folks that may be aware, are other coalitions, other groups, and then finally, who's out there, who's your possibility, which is really the identifying part. That we actually have definitions here. So it's prettier to look at the circle, but I talked about this. So the day-to-day work people is the core. The engagement, people committed to the plan and called in to help with specific tasks. The champions, they often are your sort of your VIPs, and they could be cheerleaders, and definitely people that might not ever be in the core circle. They might always just stay in that circle of champion place. So the information and awareness, I think, is that they can know about what you're doing. Again, they may never come into your core circle or even your circle of engagement, but they do need, it's kind of the idea of your board of directors is really your core circle, your engagement, even your champions. But some groups, some organizations have an advisory board. That could be your circle of information and awareness. Those people who you really connect with for specific things, and maybe even give awards to or honor. And finally, all those people, as I said, who are related and who might be, and those are the people that you probably want to think about identifying to bring in. And I think what's interesting about this, and what I like about it, is you can use this as a tool to think about who you have where, and then who you are going to target, and really connect this with the chart from before with that levels of engagement. A story I'd like to tell about this is a story that I've heard a while ago about a group of a coalition that really wanted to get a sheriff involved in their violence prevention work, in their coalition substance abuse and violence prevention work. And they really wanted to bring him at least to the circle of champions, and they did everything to get this sheriff's office engaged. They contacted them, they called them, they went to the office, they tried to invite him to a bunch of events, and it just wasn't being successful. And then finally, someone went, the sheriff was having a barbecue, he was running for office again, having a barbecue. So someone from the coalition went to the barbecue and made a personal connection at that time. So sometimes going to those funding events is important. And the sheriff got very interested in that, in the organization, the coalition, and he ended up staying and coming into the circle of champions and staying in there for a long time, and then actually writing the coalition into the budget of the sheriff's department. So they had some sustainability in terms of funding after their grant wore off. So I think those are the kind of strategies to think about as we move into really identifying some strategies for engagement. So I do just want to encourage you to use this tool to really to strategize, to think about it. I think sometimes we get so caught up in doing the day-to-day work and the activities and the events that we really forget how much planning that needs to happen, how much thoughtful strategy can happen, even with some of these tools that we're providing you today that aren't really complex tools but can be very helpful. So we're going to move into another poll. Because we did want to move into some really concrete strategies and then want to leave time at the end for questions. But we thought we started out with, at the beginning, with some of your challenges in identifying, and maybe we can look at those at the end again because I think people might have added to them. And we will move back into really identifying and recruitment, but because we're talking about now engagement a little bit, we thought we would really look at some of the barriers to partnerships, because you can identify folks, but then how do you really get them come to the table and stay at the table? So here, and we've talked about sort of the opposite of these, being very clear in your goals, but if people don't understand what you're doing, then it's going to be very hard for them to join your movement. You really do have to be clear, and I remember this really clearly because for a long time we've talked about an asset-based approach in working with communities and young people, And my brother, who is not in the human service field at all, came to visit, and so I said, you should come to this meeting with me. We're going to be talking about the asset-based approach in working with young people. So the idea of, really looking at the strengths of working with young people and the strengths of communities, what is standing out. So he came with me, and he sat there, and I don't know, it was an hour and a half meeting. And at the end, we were talking, after the meeting, we were talking about it, and he said, it took me like 2/3 of the meeting before I understand that what you were talking about was strengths of young people and not like assets in terms of real estate. Because that was his only interpretation of real estate, was an asset was like a real estate, he's in real estate, real estate or fund or money. Well, we were really not talking about that at all. We were talking about the strengths of young people or the strengths of communities outside of that. So I think it is really important. I mean, that's really more language and communication. But if your goals are not clear, I think then it's really hard for people to buy in on what you want to do. And I also think that it goes to being on the same page about the goals. I think you can talk a lot more about this second bullet, cost to members exceeding benefits. And I think that's another really important one. People, and I think later on there's going to be a training and maybe some information that the Community Health Training Institute is going to offer around other coalition development. But folks have to really believe that they're getting something out of it. And if they're not getting something out of your meetings, or the meetings are not well run, then it's not really going to be a benefit. So if you've identified these particular people you want to join your coalition or your group or your organization, what are they going to get out of it? Not only what you're going to get from them, but what are they going to get from being a part of this? If all the decision making, the third bullet's about if all the decision making happens with a few people, then obviously it's hard. A lot of us don't want to do the work and have no involvement in decision making. Top-down work through external mandates, that's really challenging when sometimes our work comes through grants and there is mandates from how the grant needs to be run. But I think that is something that can be talked about and be very transparent about as well. Timeframes that aren't going to help us, and part of this is the unrealistic timeframe is really, do we have small steps of achievement? If you're just planning and planning and planning, it isn't very, you're going to lose people. You need to have, people want to do something and feel like they accomplished something. So what are some small steps along the way? And finally, this is a huge one, lack of trust and time. That's a really important one in terms of folks being able to believe that you're all on the same page. And I can't tell you the number of times I've worked with groups, coalitions, that say, oh, well, once money became involved, once a grant became involved, everything changed. Well, that's maybe realistic that it would change some, but if you don't really trust the people that you're working with, or they don't trust you, that's going to be challenging. So let's have a little poll here to see which of these you find most challenging, and then we maybe talk a little bit about some of the ones that get the most votes. So yeah, it's time for you to jump in and do a poll. We'll just give a minute more. Folks are still voting. Everyone should vote. Okay, I think that's the majority of folks that have voted so far, so we'll jump it up here. So, wow, big percentage on the unclear, realistic, and our vague goals. Folks could vote more than one thing too, so it's very interesting. So I'm happy to see that most people feel that your barrier isn't trust and time. That often is a high one. I think those are hard ones to address. So I'm glad for you all in this webinar that they're not the most important ones. But I do think the issue of goals is critical, and I think sometimes we have these broad goal statements that could mean many things to many people, and we do not spend the time really talking about what that means, whether it's in a retreat, whether it's an extended time when people come together. with food, which is always an important piece, and really spend some time in talking about where are we going and what are our goals. I believe in, and by retreat I just mean an extended time when people come together and it's not a business meeting with a short amount of time. But typically retreats also include some team building, which is it's an important part about the benefit to people. A lot of folks come to things because they do want to meet other people and maybe help them in their other parts of their life. But I do think spending time on the goals is a very important piece. And I know folks need to balance process with product. I know that there are those folks that want to get things done, and there are the folks that want to spend more time developing relationship. But I think to err on the side of only being about product and only being efficient really doesn't let people build the relationships and have time to really talk about what that goal means to them. And I do think that the leadership of a coalition needs to start out with some clear ideas about what the goals are, leaving it open for people to give feedback and be able to come on the same page. So it's great to think about that and think about for your own coalition, for your own group. And I always say coalition because that's what a lot of this webinar is intended for. But certainly, if you're coming from an organization or a project, you can think about all of these things can apply. So really, I want to encourage you to think about being clear about where you're going with your goal. And a goal is a broad word, and lots of times we get stuck in, a goal has to be very broad. But I'm also talking about your outcomes and your objectives. Where are you going, and how are you going to get there? To your roadmap, so to speak. Okay, we're gonna do a couple more things just to get to very specific tips, and then we're gonna move into questions for our last piece. So this is a broader about drivers for successful partnerships, just relating to the barriers. I'm not going to spend a lot of time here because I feel like we touched on them when talking about the barriers, but it's not specifically related to partners, which is I have the next few slides talking about that. But I do think that the idea of clarity of goals is on there, obviously, but the sharing the data is an interesting one. If we have access to data about a community, or we have access to anything that helps move our project forward, if that's a resource, and sometimes people get very protectorate of their data or very turfy about their data, and I think it's really important to figure that out and be very transparent about what that means. And if you need to give credit to folks, that's fine, but if you're really coming together to create community change, you need to be clear about sharing the data that gets you there, or that you're building from, or your baseline. And obviously, we've talked about the other ones. I do think in the last one, ensuring productivity is a key one, and that relates to what I said a little bit ago about the mini concrete steps of moving forward. I've just been involved with too many groups who are really spend a lot of time planning, and maybe it's a planning group, but I think even with a planning group, if you want to really have multi-sector folks, community folks, residents, people that aren't paid for their time necessarily there, then you really do need to make sure they're getting something out of it, the mutual benefit, and some of that's making sure that you're moving towards a goal. So I wanted to share this case study before I move into the tips, because I thought it was very moving and sort of applicable to our times. But this was told to me actually by Steve Radini, who heard this. He actually just heard it too, but it was quite moving. This is a fence along the border between Mexico and the U.S. And it was, as you may or may not know, there actually are a lot of fences already. I just heard on the radio this morning there's already about 10% of our border has fences already. And these two groups wanted to come together, and I believe it was in El Paso and Juarez. Which share a border. They wanted to come together to work on a lot of the young people, and a lot of people in general go across that border. It's very fluid. We've actually done quite a bit of work there through Health Resources in Action, and they were working on their community safety programs, and they could not, at that time it was very dangerous in Juarez, so they could not, through their organizations, could not cross over the border. So they actually brought tables to this place, and they got permission from the Border Patrol or whoever, and set them at this fence, and they were so intent on trying to continue this partnership and create this partnership that they had their meeting and I think it was like a retreat in this place, and they set up tents and they talked through the fence. And I just thought that was so moving on the power of partnership and how important it is and how you can really find ways around problems if you're willing to sort of stretch yourself and go outside the box. So I really thought that was a valuable lesson. And where are there places in our communities where it might feel like an invisible wall, just like I was talking about earlier with the nighttime people in Rosendale and the daytime people? How do we bring all of those people together who may not feel like it's easy to be together to solve our problems? So moving into just some really concrete tips, in most of my work in the years I've been working comes down to some very actually few strategies. I mean, I think sometimes strategies are really outside the box and creative, and they're exciting, they're connected to technology, and they're connected to doing things differently. But I think in terms of building relationships and in identifying and recruiting people, it's some of the basic things that we know and that you probably know, that it's really about personal contacts. It's about thinking through, it's about strategizing, looking at that wheel, thinking through who you know, who everybody knows, and then who other people that you know. So using your contacts and using your friends, I think those are really important pieces of it. I tend to, when I think of trying to bring someone into a coalition that we really need or a group that I really want, I think outside the box of my work life. I think into every place I can who I might know that might be in. So it's both things. It's the mutual benefit. They might be interested and you might be interested. I brought up the story of the sheriff attending events. So I think that's a really key thing, getting out there. I mean, I can't tell you the number of times I've been meaning to go to something, but I just didn't go because work was too much and I need to be at my desk. Part of our work is getting out there, going to events, going to talks, going to building our own, obviously, professional development, but being in places where we're going to connect with people. We all have to figure out that work-life balance issue, but if I go to one event, and sometimes they're in the evenings, one event every other week or even every month, that reaps a lot of benefits in terms of networking. I think being persistent and patient is key. We really need to be clear that it takes time, and sometimes we have to be patient, and it always amazes me if I really spent time in building a relationship and that I didn't think anything was going to happen with it, like some months down the road, that comes back to me and that person gives me a call and says, oh, I'm really interested in doing this, or I heard this from somebody else. I heard that you were looking for this person and I'm really interested in doing that. So I think you do have to be patient, and you do have to really think creatively about your contacts and friends and ask everybody. I mean, the best strategy I know in getting people to come to anything, a meeting, event, or anything, is get them to bring a friend. Get them to think of somebody they haven't thought of before, and get them to come to the event. And then, of course, the whole issue of once they get there, which we've talked about some, but is really important. How engaging is it? Is it a learning community? Is it a place where people are getting something out of it? Are you warm when the person walks in the door? Is there food? All of those things are sort of part two of this webinar. In what are you doing once you get the people in the door? And this is that part of it. So this comes from social capital drivers, but establishing an open learning environment, I think it's kind of clever because it says engaged along the side, as you might see, but I want you to think about, how is your group an open learning environment? What are you doing? Well, think for yourself for a moment. What does it mean to you to have a learning environment? Where is a place that you've been where you really felt you've learned? something, you really felt like you grow. When I've done this as a brainstorming activity, a lot of people will say it's a place where I am learning something new, where I'm excited, where the leader or the facilitator is really interesting but open to hearing what different people have to say, where it's structured, where there's engaging things going on, where it's not just a PowerPoint or someone talking the whole time, or it's not just a meeting that doesn't have a beginning and an end and doesn't have outcomes that we actually know what we're thinking about. I read a long time ago in a tips for supervisors or tips for managers newsletter, every meeting should have at least one decision that the group makes, which I thought was very interesting. You know, so how are you engaging your group? Teams and networks, it's got to be, I think people have to feel connected. It's great to be a part of smaller groups within the bigger group. Great to have a sense of community. You know, is it their group or is it your group? Do I feel like the coalition in Roslindale is my coalition, or is it the leaders' coalition? And how do you do that? Well, you do that by having people buy into it, by feeling a part of it. Are they saying we, or are they saying yours? That's part of the ours or yours. That's part of that language. Of course, stress and balance. How do we do that? And really, what is some people want to become leaders? So how are you letting folks step up? How, and you know, a lot of it's about time and finding space, but really figuring out what, and someone brought that up very early on, what are people bringing to the table? Where do they have strengths? And finally, where is their place for input? It can't just really be about people one person leading a meeting and talking, or two people even. It's got to really be a place for everyone to have some dialogue. And really having facilitation training and really knowing how to facilitate, I think, is a really important piece of that. So I think we are moving to, we have about 5 minutes or a little more for some questions. I'd really be excited to see if you have any questions for us. And then Gina is going to close it off with some information at the end. So it would be great if you want to type up a question and let us know if you have anything, or it could be a comment, something that you wanted to say in the course of the webinar. That would be great. Just we'll give a moment, see if anyone's going to write a question.
I would like to sort of add a comment or question as people are thinking about some of this work. When we did the poll that talks about barriers to partnerships, a lot of people identified unclear, unrealistic, or vague goals. So I want us to think about, I mean, there's a challenge when we're working with coalitions or when we're in coalitions is that we become experts on our own issues. We're so immersed in the work that we get so excited about it, but then when we communicate some of that stuff, I think when people are not as immersed as we are, the way that we're communicating what our goals are and what our values are, I think, can get lost in translation. I don't know if you want to talk a little bit about how people are talking about their goals and their values and missions, making sure that they're reaching people where they're at.
I think I think I would go back and say that it's just really important that you spend some time on it. And I think sometimes we make goals and strategic plans and directions at a certain time with a certain group of people, and then as new people come in, we don't necessarily go back to it at all and have folks talk about what it means. I mean, I really do think people do this work because the value part is exciting. They want to help change in their communities. They want to help their brothers and sisters and young people and elders. And so if we don't go back and connect to that piece of the work, which I think of as the values and goals, I think we're making a mistake. And I do think that sometimes it feels like, oh, that's really not moving it along. It's not efficient. It's not really a part of the work. And so I think there's a tendency to do it once and then just to move on, and all those new people coming in don't really understand exactly why, the value of why we're doing this and how it speaks to them. Personal stories, storytelling. The best speakers and the best people I've ever heard talk about any topic are people who can tell stories about it and how it's changed them and why it's important to them. So I think all of those things can be really important in the work, in having people want to make a personal connection. They have to integrate it personally to really make themselves move in this way. So I think that is another really important piece of this work. Figuring out in your busy lives and schedules and coalitions, how are you going to really have people buy back into, well, first of all, do they even know what the goals are? So what does it mean to them? And then how can they say they want to move this forward? I've worked, as I said, with Ashland Coalition, and I've facilitated 2 retreats for them, and they do a retreat every year, and it's really hard to get all these busy people, and they have quite a large representation between education, law enforcement, government, from their community, and they do it from 7:30 in the morning to 10:30 in the morning once a year, and they're even talking about doing twice a year, where they call it a retreat. They get everyone to come together, and the first thing that we've done is really look back at their vision and mission and talk about what they have done in the course of the year that really meets that mission and vision, and what accomplishments have they had, and how does it fit into that. So people really get a sense of what we're doing in the work does connect into that vision and mission. I think it's another way to get new people to come when you do something like that. That's a great way of sort of bringing new people in, letting them see the overall work, meeting people. I think spending time identifying, we also did that. We put up around the wall all the different 12 different partners from their Drug-Free Communities grant, and we went around and wrote people that they hadn't thought of before that they might want to get, as well as who they already have involved. Sometimes new people come to a community, so it's really important to look at a community assessment, think about assessing the community, who's there and who might not be represented before. I've also been doing some work in Lawrence, and they have several different coalitions who all are under an umbrella group, and I think that's a really important thing, to make sure those coalitions are talking to each other. So it's not all the same people coming to one coalition, but they're reaching outside and trying to get different folks to represent the work of the different coalitions. One is citywide, other is neighborhood focused, one is more opiate focused, one is more alcohol substance other substances focused. So it's important, though, that to that collective impact, that they're moving in the same direction, and it's kind of awesome that they're all under this umbrella, so that they can connect, the staff of the coalition can connect about who's doing what and who's working with who, instead of doing this separately.
I think another question is sort of what can we do to continue to improve the work and connect with people, and asking about giving feedback. What are different avenues that people can continue, like you said, sort of connecting and checking in with people, making sure that they're engaging with people throughout the process?
Well, I mean, not to put in a plug for this, but I think the Community Health Training Institute is a place where you can do that. Going to both face-on-face trainings. I mean, these trainings are wonderfully supported through the Department of Public Health and resources to be able to be provided without cost. So, I mean, webinars are more a listening time, but I think just getting ideas, but going to in-person trainings is a time when you can really meet other people and talk to them, going to events, really asking people that you know, excuse me, asking people that you know in the work, setting up coffees, setting up one-on-ones, and really asking for feedback about what's not working. And I think not feeling like you're doing something wrong or you're not being successful because you're asking for feedback. I mean, to me, that I know in supporting coaching some folks in this Rhode Island collaborative, the HES coalitions that I was talking about, you know, they're doing such amazing work, and they asked for some coaching about how to delegate to some of their leadership community folks that are leadership better. And because they're asking for some support in that, it doesn't mean by any means that they are not doing a wonderful, amazing job. I think it just means, are there other ways or other strategies to integrate? So hopefully today that you have heard some other strategies you can help integrate into this work. I don't know if we've answered all your questions, but I think since there are not any other questions, that we will move to closing. I really appreciate all the work that you are doing in community. I feel like community is a broad term. It's a term that can be, as we said, geographic folks. It can be folks with special interests or common shared interests. But it's so important in the level of work that we're doing that you're really broadly impacting so many people and trying to, and that you even folks that you came to this webinar means that you want to continue to impact different partners and to reach different partners. So I really appreciate all that you're doing, and I wish you so much goodness and wish you well and wish you support in going on in your work. I'll just close with a quote that I like that I read a long time ago in a book called Urban Sanctuaries from a young man named Tito, and he says, kids want to walk around trouble, but they need some place to walk to and someone to walk with. And so I really believe that by being a part of a community that cares about young people, adults, elders, and all aspects of that multi-sector wheel, that you are helping kids and everyone build healthy communities. So thank you, and I'll turn it back over to Gina.
Thank you so much, LJ. That's such a touching and beautiful quote, and I think it's important for us to continue to think about this work. And I appreciate the plug. We definitely have some really great resources and trainings that are coming up that I think a lot of people can take advantage of. Again, as always, our webinars are free, and as LJ mentioned, a time for listening. But we also have some upcoming trainings in Western Mass later this month, Coalition Capacity and Infrastructure Training and a Coalition Stability and Resource Planning Training that I'm sure a lot of people that were present today could take advantage of. And of course, some of our engaging stakeholders and facilitated leadership that's coming up in December. And if you go to our website, you can also find some more information about trainings that we have coming up in January and furthermore that can continue to sort of build on this topic and continue to strengthen the coalitions and the work that we're already doing. Again, we want to thank you for joining us today. If you have any questions, this is Lori Jo's contact information. We will be sending out the slides and all the resources that Lori Jo mentioned in her presentation, the stakeholder wheel and all the resources that you can print out and use when we're talking about having these coalition meetings. Again, please feel free to follow us on Twitter. We continue to tweet and connect with one another, and I think this is a great way to talk about our work and really connect with one another in our community and over social media. And we also have a LinkedIn group that we'd like you to be a part of. So come join us in these conversations, in this work. And again, we want to thank the Department of Public Health for helping us provide these trainings and webinars to you for free. And again, if you have any questions, please feel free to contact us through any one of these avenues. And again, please take a look at our training calendar where we have trainings coming up for the rest of the year. Thank you so much.